Welcome to the second webinar of our series of webinars on African swine fever analysis, risk analysis, and practical tools. I'm Erika Calderon, and I work for the Inter-American Institute of Cooperation on Agriculture, IICA, and these webinars have been coordinated by the Interagency African Swine Fever Prevention Commission, and this arose from GFStats, from that mandate, so that group could coordinate efforts to prevent countries and prepare countries rather in the Americas and the Caribbean in preventing ASF. So we have different agencies that comprise this group, such as the OIE, OIRSA, FAO, CaribVET, CAFSA, COPEG, LACAN, CVP, USDA, under the leadership of IICA. This is a series of webinars that's focused on risk analysis that's comprised of 4 webinars. Although each of them are independent of the other, we recommend that you attend the 4 webinars to acquire a more holistic idea as to how to conduct risk assessment using specific tools to conduct that, and other risk analyses that have been developed and executed by different international organizations. On November 9th, we held our first webinar, Foundations of Risk Analysis. Today, we will continue with a tool that was developed by CaribVET for preventing the risk of African swine fever. On November 30th, our webinar will be risk management at the farm level. On December 7th, we will know the results of ASF risk analysis for Latin America and the Caribbean, and as I said before, have been conducted by different organizations. So now we're going to continue with today's presentations, and Dr. Maria Irian Percedo and Dr. Dorothy Casal will address the tool developed by CaribVET. It's a risk analysis tool. And let me just remind you before we introduce our speakers that questions on our Zoom chat and social networks will be done through the chats. So I'm going to introduce Dr. Maria Irian Percedo Abreu. She is a vet, a researcher, and she heads animal health and in an organization called SENSA. It's a center that collaborates with the OIE for risk reduction in animal health disasters. And she's participated in different endemic and emerging disease control efforts, such as ASF, when it impacted Cuba in 1980. Gastroenteritis and hemorrhagic disease in rabbits as well, and classic swine fever since 1993. Her PhD thesis was on a methodology for territorial analysis in health disasters in 1988, and she's an expert in a multidisciplinary facet of emergency disasters, and she heads the National One Health Network. She's a member of a risk assessment sectorial program experts for the reduction of disasters of the Minister of Science and Technology and the Environment, SIDMA, and she participates in different CaribVET epidemiology and swine diseases. So although Dr. Dorothy Casal has not yet connected, he will in a few minutes. He's a vet. He is a dean at the Autonomous University of Barcelona since 1984, and he researches at an institute called IICA for various years now. He's a tenured professor at the veterinary department. He's published more than 100 articles that focus on disease transmission among herds, including risk analysis. And he collaborated in developing the tool during an internship at the Surat, and he currently collaborates in that realm. So we're going to hear from the experts that will speak about the CaribVET vet risk swine tool. Now, if you haven't yet obtained it at any point in time, if you send us your contact information, your emails through the chat, we will happily get that to you. So you have the floor, Dr. Percedo. Morning. It's a great pleasure to be able to be here and speak to you about our risk swine tool for risk analysis that we developed within CaribVET with a group of experts from different from our work group and our efforts on epidemiology and porcine or swine diseases. CaribVET is the committee of the Caribbean Animal Health Network. Now, the tool is was developed by CaribVET mandate to develop a risk analysis tool to address priority diseases. That is why we first focused on using the tool for classic swine fever, which is impacting Cuba, which impacted Cuba, Dominican Republic, and Haiti. And then after the onset of Tesco virus encephalomyelitis, TE, we used the tool as well. And in 2013, when the United States was impacted by porcine epidemic diarrhea, PED, and that also impacted Cuba, the Dominican Republic, and other countries in the Caribbean and South America, in Latin America. So when the risk of AFS was imminent for the rest of the world, after it started in China in 2018, we developed this tool for risk analysis of AFS.
Doctora María, no le escuchamos.
Percedo, we cannot hear you. I think you're muted. Sorry about that. Okay, so we're going to quickly summarize the different, general aspects that are tied to risk analysis or risk assessment. So we have to keep in mind that when we conduct these types of analyses, we have to already have all of the information required by the tool to proceed with the assessment. Because we developed the tool with the following objective, that the risk assessment process had to be led by the official veterinary, country veterinary health services. But it's important for all stakeholders to know, to understand the risks that each country can face with regards to a possible introduction of this disease. But they also play a very important role in the different phases of its entry and prevention as well. So we're here addressing countries that perhaps we also want to reach out to non-national vet authorities, private sector, the maritime sector, the tourism sector. So it's meant to address a broad gamut of sectors that could be part of this context, and that could also provide their own criteria to assess the different risks that they face in their own organization. And this is important to take into account with regards to prevention and control in the event of an onset of the disease. So risk assessments have to be done transparently. One, where each can contribute the main problems that each country faces. And what vulnerabilities they have in the event of possible introduction of the disease, and not be able to curtail its entry on time. So it's a tool to be used by each country. So in this regards, it must be looked at in a transparent manner from all perspectives, dealing with the risk assessment to attain satisfactory results. The results obtained through this risk assessment and the tool must therefore be able to take into account existing gaps in prevention and eventual control of the disease to avoid its entry and adopt the necessary guidelines to be able to reduce it and manage it. So as we are well aware, and as it's been established by the OIE, the risk analysis procedure has 4 important stages. The first one is identification of danger. Here we're focusing on African swine fever. The assessment of the risk, what we obtain from the management side, the management phase, which is to analyze what measures have to be taken to reduce the risk. And that this process is all occurring while we convey risk or communicate risk. For example, if we want to include this in trade of animal trade, because or merchandise or food trade. So this has to be conveyed to the stakeholders to make sure that the import, if infected, will not move forward. So risk assessment or analysis has these features. It includes constant communication with the different stakeholders, and that is what we want to emphasize, especially during this phase of risk assessment. Everyone has to know what to do in the event of the emergency, or what has to be done to prevent it. So there may be many objectives. For example, there may be a risk assessment to make decisions with regards to imports of animals or products. But what this tool does or proposes is using risk analysis to identify vulnerabilities or current vulnerabilities with regards to the health defense barriers that are part of the efforts of that country to prevent a disease such as African swine fever. So we're trying to analyze the different risks, to assess risk, to avoid the introduction, dissemination, and ensure a rapid response of all of the different system components in order to provide protection in the event of entry of the disease. So the objective of the tool that we're going to present is basically a tool that will make it easier to identify or conduct a risk assessment in the event of introduction or spread of AFS in a country. The tool is trilingual. Spanish, French, and English. It's based on an Excel spreadsheet. It's very user-friendly to be able to be used by different countries throughout the Caribbean. That is such a diverse and multilingual region, simple to use, and includes different guidelines and questions required for that objective. From page 1 on a menu that can be observed at the bottom of the screen, you can see the first page that is called the framework of the work, which is, well, it's a menu, it's a work framework, and it just shows the process to be able to attain the ultimate result or the final results. Then there's another page where the use of the tool is explained. And it's used in 3 languages, as I mentioned. And we can see the different criteria to be able to assess the predominant porcine systems in each country as an important element to consider in a risk assessment. Then there's a page where each of the features used in the analysis has a score. And then you can see the different aspects of the process, the different texts in the 3 languages that are used. So here, that we're mentioning the different, points or scores, and we can look at the, from page 1, we see the different menus, showing the different steps that this analysis entails. It's a page the figures that are there, the numbers cannot be changed because it impacts the risk assessment. So these are the values that the tool requires to function. It's important to consider. So the tool that we propose will provide a qualitative risk assessment, and then a qualitative score is assigned. But it is a qualitative risk assessment, and we all know that it's been at quantitative analyses are allowed, but qualitative ones require greater information, a greater quality of data that's not always available. So the best approximation for this type of risk assessment is met through a qualitative procedure as we propose here. So the tool is divided into 3 sessions, 3 sections. The first one has to do with assessment of or spread of the pathogen in the impacted country. And then the second phase is assessment of exposure or spread of the pathogen among the susceptible population in the country. And lastly, the third stage is assessment of the consequences of introduction of the pathogen to the country. So the values that are used for the different phases of the analysis were defined by groups of experts, considering the differences among the diseases. Remember, it's a tool that makes risk assessment possible for AFS, classic swine fever, TE, and PPD. During the first stage, or PED, sorry. During the first stage, well, as we recommend, there are different aspects that have to do with the impacted country and how that disease is analyzed. So its distribution measures qualitative information is looked at. Quantitative information, sorry, is looked at. And then an analysis of the different routes of entry of the disease in the country is considered. So a qualitative risk analysis is done of the possible route of entry, for example, through illegal or legal food trade, through the transportation of objects, through different regions. For example, in the Caribbean, there's a risk through international garbage that arrives at arrives at the coast, and that's a reality, and that poses a risk as well. And we assess the possible risks in the event of a disaster that would disrupt the context of each country, and that could lead to floods, for example, that would increase the risk of entry of new diseases to new territories. Now, lastly, at this session, we assess the introduction of the pathogen in the country that's exposed to that. And we focus on the assessment of the quarantine measures in the border region. How many quarantine points are there? What is the situation or the veterinary status that exists? When we look at health measures, we're not only looking at there being a national vet authority that will conduct an inspection, but if the health surveillance efforts address residual aspects, for example, if there's technical controlled, that's appropriate. When we look at dissemination of the pathogen in the country, and if the disease enters, well, we analyze the health vulnerability of the exposed country. Quarantine, efforts, diagnostic efforts, the structural vulnerability that has to do with the swine industry throughout the production chain. And also a mandatory notification system. If there are courses or skills required to ensure effective epidemiological surveillance system, if there are enough resources to conduct sampling, transportation. And in this part of the assessment, we always conduct a proposal to analyze the different characteristics, the predominant ones of the porcine production systems in the country. Because we know that it depends on the conditions of biosecurity, and we're going to see that later on to be able to qualify the risk addressing the sector. Also, we also know that ticks act as biological vectors of the disease, and that's another important feature to look at. So we also characterize the industry and assess the intention and to address the different types of objectives of the industry, the swine industry.
Se tiene en cuenta las características de los sistemas que predominan en el país.
So as I was saying, it is important to take into account the systems that are currently in place in the country. Therefore, we are using a proposal that was created by FAO for the agriculture, and we adapted that for the case of the swine production. So this The swine production, we evaluate this to see if it belongs mostly to Sector 1, Sector 2, Sector 3, or Sector 4, which in its ascending numbers, it diminishes the biosafety measures. It means that we're talking about a predominant production with low levels of biosafety, like Sector 4, for example. So it assigns more time and more points, and Sector 1 refers to the industrial systems, integrated systems with high biosafety procedures. So this will go normally to the general market. This means that as long as some of these sectors are defined as priority, then the system of points, it's changed depending on the sector. Then at the end, we evaluate the consequences of the introduction of the pathogen into the country. And here we have focused on trying to realize what is the magnitude of that consequence in each different sector and in different lines. For example, if we could face loss in the export of these animals or loss in relation to the export of agricultural products. For example, we have to take into account that we must say that even though when it is a disease that affects only the animals, many times there are restrictions to the export of agricultural products because precisely, well, they come from the field. So the importers can think that there's a risk, so they limit the export. Also, in case that there is a diminution in the availability of pork meat and the subproducts, this is in the internal market, or if there is an impact in the swine population at the genetic level, that is also a factor. We also have to think that the impact of these diseases affect in different levels to the different producers. Let's say if it's a small producer or a large producer. Also, it has a social impact, a social cost, because it affects all the producers that depend on this production. And this also has a huge impact in the way that the consumption of pork meat, it's part of the identity and the social practices of different countries. And it is an element that it's also included in the analysis. In the previous seminar that we gave, there were a few questions regarding the knowledge that we have about the ticks, the soft ticks in our hemisphere. So just as an example, I brought here some publications that since 1984 were made talking about this same subject. So in this publication, you can see that there is a reference about which are the ticks of these specific gender that are present in the Caribbean. We know that in other areas, the ornithopters, for example, in Iberia, these are different ticks of different genders that are present in vectors of the virus, as vectors of the virus. But in our region, we have identified other kind of soft tick that are vectors for our region. And in further studies, they were identified in the publication of 1987, the ability that some of these species have when transmitting the disease. For example, they transmit the virus in long periods of time. They transmit the virus within different states, and they are ticks that are present in our countries. Some of them are connected, for example, between Dominican Republic and Haiti. And this was verified that yes, this they got to the conclusion that they could be infected easily. And this last article of 2018, this refers to these different species. It talks about the result of the experimental infection of lab ticks. And it makes a reference in particular to the ones that have been reported within the United States. And these are the ones that appear here. So this way, this is information that it is general information about the subject. And also people were asking the participants of the seminar, what is the role of these ticks in the transmission? So it has been described that when the disease it's present where the swines are being developed, where there's not a lot of biosafety, these ticks are normally in dark places, in rural places, mostly in pigs that are raised on the field, on the farms, and that's where the ticks may stay there and may transform themselves into a vehicle of passing this contamination, this disease to other animals. So mostly you're thinking about that the introduction could come from ticks that are in imported animals, unless it's an animal that has been imported from a neighbor country. We should not see this as a danger of introduction, but mostly a danger that when the virus is within the country, that if there are ticks around, then it could become a risk for the spread of the disease in the territories that we're talking about. So up to this point, I have described the general aspects about the tools. And now we wanted to move to a second stage of this presentation with the demonstration of the use of the tool that you could see in these Excel pages, as we have told you previously. If you want to make any question before we move to this tool, please go ahead. Or if you want to go ahead and move to this stage and then you have questions, we could also do that. Yes, let's do that. I think just to let you know that Dr. Jordi is here already. And we will leave the questions for the end, okay? Thank you. Well, this is Jordi. Thank you very much for the invitation. I want to take the opportunity that Maria Aiden is changing her computer. I just wanted to, I apologize that I was not able to connect earlier, but here I am. So thank you very much. Welcome, Doctor. Thank you.
¿Pueden escuchar?
Can you hear me? Can you hear me well? Yes, thank you. Can you hear me now? Yes. The only thing that is that we see the empty chair, but yes, we can hear you.
Doctores, no sé si están...
Can you hear me?
en este momento.
Yes, just one moment, please.
Un momento, que es que no tengo extensión del micrófono que se está-
Yes, just one moment, please. I don't have the extension of the microphone that it's being used. I have another one that is by the side of my computer. So I'm trying to connect this. I'm trying to sort this out. Thank you so much. Just one moment, please.
Listo. En lo que la doctora María
So while Dr. Mary sorts out the technical issue, I would like to invite you to make all the questions. Yes, and also in the social network or in the chat. Remember that there isn't a way that you can register in the social network so that we can have your contact and give you some material. Thank you so much.
Hola, a ver, soy Jordi. Oye, si hay problemas, otra opción es que yo...
Yes, if there are problems, another option is that I can share my screen and I can continue talking about it while Maria is commenting on that. Yes, that would help.
Bueno, se lo comentáis a ella y si queréis me apunto, vamos.
Jordi, ve adelantando ahí la presentación de la página y yo resuelvo el problema técnico acá.
Yes, you can go ahead while I sort out the technical issue, said Maria. Okay, let me try.
Supongo que la veis.
I suppose you are able to see
la
this?
vemos perfectamente, doctor.
Yes, yes, we can see it very well. Thank you.
Bueno, entonces la presentamos por acá. Jordi la va.
Yes, okay, so we're going to connect here. Jordi is going to be displaying it. And as you can see here in the first section of the page, there are diseases that are included in the proposal of the risk analysis, each of them with their own characteristics. This first part is so that we can select in the menu that are here. In each disease, you will see the one, you select the one that you are interested in this case, the African swine fever, and also the language that we want to use because the tool is available in different languages. Then afterwards, we start with the procedure of risk analysis that we have talked about. And the tool, I must say that it gives the opportunity of analyzing the risks of each specific country. It means that we can analyze the risk starting with thinking that a country that we have different types of relations can be affected by the disease. And then afterwards, we do the analysis in relation to this particular country. And this tool give us the opportunity to analyze once and for all the risks that are present in different countries. So here we have, for example, country number 1, country number 2, number 3. It means that we could do the analysis, the risk analysis, in relation to the risk that might be coming from different countries. So in the first page, we refer. I'm sorry, I'm going to change a little bit my position so that I can get closer to the screen.
Bueno, nos disculpan,
Please accept our apologies while we're trying to adapt to the current circumstances. So in this first stage where we select the kind of disease, also the period, so that we can see what kind of information we're going to need for the next segment. So then we analyze if the disease is present in neighbor countries or in our geographical area, or in countries where we have legal trade or any other kind of trade. And that's how we get advanced, trying to figure out what are the issues surrounding the disease that we're talking about. So that way we start trying to analyze what is the process that we're talking about. Also, taking into account having the characteristics of this pathogen, we evaluate the importance that could have the different merchandises that trade could imply a risk in terms of the introduction of this disease. For example, if they are bringing in live animals or pork meat, etc. And once this has been evaluated, all these conditions have been evaluated, then we can move to the first step, which will be the evaluation of the dissemination of the pathogen. So in all this part, we are talking about, as we have just mentioned, in simultaneously, we can combine one country to another, and in each case, we analyze, and this will give us a result, a factor that will determine if the risk is high or not. And this will depend on this menu here that you are seeing right now on the screen. So we put this, we just decide how do we consider that the risk, given the conditions that the tool is asking, do we think that it's a high risk or a medium or a low risk? So for example, the disease in the affected country, how do we consider this? High, medium, or low? Then, for example, how is the disease spreading in the affected country? Is it in the whole country or is it just one region, for example? And then the answer says all the country or some regions. And then we just move on and on, answering the questions. For example, if there are control measures, if there are vaccines. For example, in a country there are no vaccines available, then that affects the risk. Then the execution of the different programs, is it being implemented or not? Is it in all the country or just in one region? So also, which are the dissemination routes within the affected country? So it's little by little giving us an idea of the dissemination risk in that particular country. And this also measures if we think that the risk is through the legal trade or the illegal trade of the products or byproducts. So this is taking into account all these conditions. For example, if is this through the persons that are transporting the animals, or is this indirectly? Also, we can evaluate the type of the transportation and the links that are between the different means of transportation. For example, we ask information about how many flights or how many trucks during each week going in and out of the country that we're analyzing. And also, if we think that there could be a risk in the border of each of different countries, for example, in terms of the Caribbean countries, and also as a result of situations like natural disasters. So up to here, we are linking the different factors with the analysis, and which will be the transmission lines and how this could come into the country, into the affected country, and which will be the evaluation that we could do if we consider that the risk is too high for each country, or if it is very high in some of or all the different categories. So this is a tool that helps us to gain clarity in terms of what kind of risk are we talking about. If we think that we are vulnerable in the protection of the country, so we can avoid the introduction of those diseases. So now we will move to the other steps in the analysis process. We start evaluating the possible introduction of the pathogen of the country where we're making the analysis. And as you can see here in the blue box, starting from this segment, the questions and answers referred to the exposed country. The first thing that we evaluate is the quarantine measures. So if we're talking about quarantine inland, in the border, how many border check controls we have, and if we have veterinary controls in each border. For example, if we don't have enough proper veterinary stations in those border control entries, then that makes the risk even higher. So we have to figure out how, like in these borders, how do they manage the waste management? How do we, all these different things. For example, it is also happens at international airports that may or may not be with veterinary control. So all these factors help us to evaluate and give us a result in terms of how do we think that the risk of introduction is, if it's a high risk or a low risk or a medium risk. And this will help us to determine what is the risk factor in relation to the country that we're talking about. And once we have get to this stage, then we see how the points accumulate. And then we move on to the second point, which is the evaluation of the dissemination of the pathogen within the country. If there is, for example, a system with that enforces the publication of the information, letting people know that there's a disease there. So from the legal point of view, this is pretty important. If the system of surveillance of the disease, how is this system? If this is in all the country or just in a few regions. So at the beginning, I was mentioned about the importance of the transparency in terms of detecting on time and containing on time this kind of disease. And therefore, that's why we evaluate in the different categories how efficient, our system is. So we're seeing this if we're accumulating enough amount of points. At the same time, we were talking about the resources for the sampling. So do we have enough resources and vehicles to do a sampling, to do a good diagnostic treatment? So the different diagnostic on different endemic diseases. This is also important because it's not about just having this specific resource to ensure a quick diagnostic. For example, in this case, we're talking about the African swine fever. So is there a diagnostic in this country to figure out if they have similar clinic behavior of the samples? In this case, we're talking about the African swine fever. We also need to have the ability to have this diagnostic. For example, if the results are negative, then we have to presume that it's talking about a new disease. And in this case, for example, the African swine fever, the diagnostic system has to warranty the endemic disease, and it has to be able to figure out if we're talking about a new disease. Also, we have a notification system that should be a timely system in terms of levels of mortality and in the swine population. So this is part of the surveillance program. It has to be considered, it's part of it. And also we move to a different point now, which is the characterization of the swine production. So being able to understand if they are ticks of the ornithodoros gender, and we think that if this aspect is not considered, it should be considered now for those countries because it represents a risk factor. We have to understand how this is affected in each country. And if they have the ticks that have been mentioned, that could be potential biological vector of the virus. And also we have to take into account which are the swine systems of the kind of production in the particular country. And that way we can figure out how is this being used in that particular country. And it's important to analyze the system that the swine system that is used in each country and region. And also we have to evaluate which are the production system. For example, the family production system, it's different than the others and not only convey a bigger risk. So we have to take this into account, and we will give higher points to those that have high risk. And also we analyze the risk of spread of the infection. For example, the spread to cattle and the spread to other animals, because sometimes in our countries, let's say there is they sell the pork products, but they're not supervised. And whenever you have those risk factors, you also have to analyze how is that this situation in relation to trade of pork products, how this is transmitted into another countries, this risk out of lack of control. Now we're going to evaluate the characterization of the industry. In this part, we can focus on evaluating for each of them. We're going to be evaluating these links, for example, the slaughters in the different levels and in different places.
So finding the number of facilities that have these products and assessing the level of vulnerability in these places that can help facilitate, that can make sure that given a veterinary inspection, that there are no lesions in the animals compatible with the disease. In the possibility that we could assess each of these different stages or these, because making sure that we can obtain traceability of the commodities that come from these establishments or facilities can make sure that we can trace them and make sure that we know where these items are and know where the products are going to go. Traceability is very important, therefore. Be able to understand the areas that can be impacted by industry and trade of the affected animals. What are the conditions for residual treatment of these facilities? If disinfection measures are taken, of transportation, disinfection is done. If they take care of their garbage, control the garbage, and understand that these measures are complied with. We need to assess the health vulnerability of the country under study with regards to the deficiencies in the different links of the swine industry.
Perdón que le interrumpa. Me piden que se acerque un
Sorry to
poco
interrupt you, Doctor, if it's possible to just get a bit closer to the mic. Thank you. So we are now at this stage where we want to try to understand the objectives of swine diseases and assess the vulnerability, the health vulnerability. So that's why all stakeholders must be part, or we invite stakeholders to become part of this process and be able to, well, understand in a transparent manner and see the types of vulnerabilities that exist in each of these links and understand the commitment that corresponds to them to strengthen and understand the defensive capacity in each of the countries. So we definitely, well, when we try to understand these three aspects, everything that has to do with diagnostics, with surveillance, with industry, and characterization of predominant productive systems of the swine industry in each of the countries, well, then we know that we have a good result as to how we've assessed the risk of spreading and exposure of the virus in the population in each of the assessed territories. Lastly, we move on to assessing consequences of introduction of the pathogens that I mentioned. Well, take into account the different sectors that could be perturbed and impacted by the introduction of this disease. And producers in their at the different scales or levels, not all of them can be able to satisfactorily overcome the disease. Regularly, smaller, medium-sized producers could be most in the long term. And it's very hard for them to recover. They don't have the same income levels as larger producers who can rapidly, well, overcome the emergency. So it's all part, so being able to overcome this crisis really starts with a good system of defense and assessment. So as we mentioned, if we look at all the different parts that we include in our risk assessment system, it lists it. So quantitatively, we are able to assign, since it's qualitative data as well, we assign a score based on each of these elements, or what we've defined for each of these elements, and it gives us, we can gauge the risk, level of risk that we face. So the higher the score, the greater the risk, the higher the risk of spreading and consequences of the disease. And that's an important aspect to consider. We're going to show you the different pages and look at the summary. The summary page shows me a table, and we can see here the different qualitative scales, and then at the end, we see a risk assessment for the different countries that conducted the assessment. 1 to 4 can be done simultaneously, or we can work on them independently, but always considering when we assess different countries, the only thing that changes is the risks having to do with the spread of the pathogen based on the country that we're analyzing. Because if we look at the different aspects included in the assessment, they all have to be related to, well, the country that's facing the risk. That does not change, although we may change the country. And then we assess the potential of the spread of the pathogen. So now we also can see next to the table different aspects that, based on the assessment made, must be considered as aspects to be improved upon. If the result is that the risk is tied to the conditions of the country of origin because everything else looks okay, well, then we emphasize that given the number or the score, we look at what can be improved or not. And if the risk has to do with animal trade or animal product trade, if it has to do with deficient systems having to do with vulnerabilities in the country, or if it has to do with the status of livestock, for example. So at the end, it's a summary as to where we should direct the efforts of our analysis in this process, the analysis that we want to conduct by the veterinary health services and the interested parties, because we want to reach a consensus where we all aware of the different factors that, to see if we meet the factors, to see how high the risk is, where the gaps, where do we have to take action to produce the deficiencies that have been detected, and everything that we're trying to include in the analysis plays a role in the possible mitigation of the risk identified in the assessment process. So, next page. Well, here we see a complete statement having to do with the different aspects included in the assessment. So it mentions how CENSA conducted aspects for determining the guidelines in this assessment, the veterinary health service in London, Jordi's University, where he in Barcelona, and the CaribVET, other CaribVET organizations. They're compatible with Excel 2013, and it mentions that any sort of mishaps that can be found in using the tool. If you find any sort of complications with the tool, you must contact Jordi. And below, we see a guide as to how to use the tool. And it just includes all the different elements that we've already presented in the presentation or already mentioned. So you can look at the different steps, the features, by entering this site that is also in the 3 languages mentioned. So you can see greater weight is given to the different parts of the system, and then the different languages. We can also determine the swine systems, the porcine systems. Here we can see it in English and in Spanish. How we assess the productive systems by adapting the assessment as proposed by FAO for agriculture, and we adapted it for swine production, and look at the different aspects to consider if the system is an integrated industrial one, if it's swine products with a higher or lower biosafety level, and looking at the different, characteristics. The next page. We had showed it to you in the presentation, and it includes the different values assigned to in each of the aspects that have to be assessed. And for the different diseases, CS, classical swine fever, testicle virus, and porcine epidemic diarrhea. Lastly, that's the last slide, it's a glossary of terms. So you can see all the different texts, and it's an index. We can say every text that is referred to by the tool in the 3 languages. And we can see the different expression, or how the expressions are mentioned in the different languages. So we refer to it as a dictionary. We go back to the initial page, the start page, or the home page rather, and hopefully with this general explanation that I've given you, you can all feel a little bit more more comfortable in analyzing the questions or any questions that you would like to ask. And Jordi will be available to be able to answer any of your questions, if you have any questions, that is. I have a brief comment, if you may. Okay, in gray, on the right, we see that there's a help, or there's a sort of explanation that can refer as a cross-link to the glossary. So it's a sort of a help tool. So you can see, you can always go back to our index, but the text itself is self-explanatory. So let me show you. So gray shows what's important to take into account for each item, and it helps you fill out the information. So let me just mention that in the different Caribbean countries, we developed these systems, and we use macros. And perhaps some countries may see a difference in the presentation, in the visual presentation of the tool, but we decided to withdraw the macros because it didn't work well and they caused some problems. So that's why we recur to these explanatory boxes that Jordi has mentioned, and they're in gray. And you can access quickly the information, the supplementary information that can help explain things further for the user. And it's the content is the same as what we have in the back. But we just took out the macros and include these accompanying texts, supplementary texts, which truly do help with the explanation when you access the different parts of the system. Okay, and also one more thing, this is a more robust system that you can use in different versions of Excel. I think OpenOffice can also use it, so it's much more robust than what we had before with the macros, because sometimes they just didn't work. It was nicer, but it just didn't work well. Didn't always work well. Perfect. Wonderful. Thank you so much, both of you, for your presentation. It's a very interesting, important tool, very practical for the countries to use. And I'm being asked if you could share that presentation. Of course, everything that we're presenting during this webinar is available in our the social media. And if you send us your contact information, we could also send you the tool so that you can use them. Doctor, if you all agree, we'll move on to the question and answer session. If you have any other comments, feel free to mention that. Oh, we can go on to the questions. Great. So can this assessment be done as a group, individually, or both? If it's individual, is there a way of consolidating the information afterwards and obtain a median? Well, I'm not sure what you referred to, group or personal. Well, the tool can be used by anyone, really. They can do a preliminary assessment based on the knowledge that they have of the information being requested. They don't necessarily, well, have to ask anyone else. What we try to do is to have as many stakeholders available and always led by the National Vet Authority, because that is how you raise awareness of your responsibility in avoiding problems that are identified during the analysis phase. But it can be done by any individual. And we also mentioned that it could be used by different countries and a specific region that wants to conduct their own analysis. So it's not written in stone to a specific format, but the more information that you have available, and provided the analysis is critical and transparent, that's what we want. That countries know what measures they should take and what their vulnerabilities are. I think the question has to do with, well, having a version based on consensus, or if individuals from different veterinary services can conduct their own. Well, it's not really preset. You can copy and add that to another website, but it's really not, the tool doesn't state if you, it only takes into account one person, but you can add a group. Yes. Thank you so much. There's another question. What is the difference of development 1 and 2? I guess the do one of them refer to stricter biosecurity measures? Well, production systems. Maria, you would be good at answering this. Well, one has to do with, Doctor, would you get a little bit closer to the mic? It's hard to hear you. Okay, one has to do with conditions of excellence to ensure the safety or the protection of the swine herd, and the fact that they can intervene in exports and are dependent on the different resources, as are mentioned, dependence on, it has to do with the industrial intensive level of that country that tries to protect themselves of biosecurity measures and biosecurity measures that have to be taken into account because of their food slaughter, the food industry slaughtering animals, animal production systems. So when you go to sectors 2 and 3, the difference between or differentiating them is the level of bio safety, if it's considered to be high or low, and these have to do with intermediate production systems that don't really, that are not as high as a higher production system would be, a medium level, and the highest score, which is the most vulnerable score, would be one of the aspects that impact developing countries. And they have to do with where there's a predominant family production systems. Because backyard farm animals also have a local market, and this restricts the distribution of the disease. But on the other hand, the disease spreads freely because there isn't really a contention measure of containment for the entry and the exit of the animals. Sometimes they're not even fenced. So these are the different aspects that are looked at and considered to classify the sectors. Thank you so much, Doctor, for your answer. Okay, there's a comment here. It says, I believe that when you face this disease in our region, I guess neighboring countries would have to coordinate to establish the right sanitary measures, and that the involved stakeholders would constantly monitor in the event of this imminent danger. Well, that makes sense. And that is what we endeavor to do, to have greater harmonization among the countries in the region with regards to how you assess risk. We look at the need of reducing vulnerabilities. We know that with support of the different countries in the Americas, with the transboundary disease program and efforts to identify surveillance and diagnostic efforts in our country, we hope that these technical training sessions will also contribute to harmonizing strategies and to help our neighbors face the constraints. Yes, we do endeavor to do that. That is why we're conducting this initiative, and that's why we're working together, the different international organizations, institutions, to help to get this information to you. We're interested in, everyone's interested in getting the tool, and we're being asked as well. I can't execute the program on my PC. Any advice? Well, I think that as long as you have Excel, there won't be a problem in using it unless a compatibility issue arises. But it's just an Excel spreadsheet. It's very easy to use. Well, this has to be very robust. Be used from any sort of computer. There shouldn't be any problems.
lo miramos, pero en principio yo creo que así como en la versión anterior sí que podía haber problemas en esta.
And since there could be problems in the previous version, we really don't envision any problems now because it's just a regular Excel spreadsheet. Okay, let me just remind all of the participants that we will get the tool to you. We have the contacts of Jordi and Maria, and through IICA. So you can ask all of your questions. And as you use the tool, you're going to have more questions. I know it's all just a snapshot and it's very superficial, but I think as you start using it, you're going to come up with further questions. Let's see if I have any other questions here. We're being asked, it's hard to calculate the costs for, is it hard to calculate costs for backyard animals, backyard animal production? Well, we can speak about this because we're working with Colombia right now on the cost of backyard animal production and diseases related to that. This is just my opinion. I'm not going to go into much detail, but I think that it's hard because, one, because there's not that much information available, and it's hard to get that information in a rigorous formal information. We've conducted surveys and we've obtained prices and costs, but I think that, well, it's not the best information, not rigorous enough. So a problem with backyard animal production is how we assess things, because we've assessed the cost of classic swine fever, classical swine fever in Colombia, for example, and backyard animal production is well, the cost for that is very low. The problem is that from a social standpoint, although it's a low production system, it can really cause constraints for the producer, and that's the problem. So it's not really about the number per se, but the fact that it can have an important impact on the economy of these producers, which are very poor. Okay, thank you. Another question. What would happen if the country does not have all the necessary answers to be able to conduct or to use the tool well? And how would that impact the results of the analysis? Well, like any scientific procedure, if you don't have the information being requested, obviously the results will not be as rigorous. So that has to be considered in the final assessment. So that's why we were saying at the beginning, we need to review the tool and try to find all of the information requested. Because I think that if there's lack of information of what's being asked by the tool, that's a problem. And that can be assessed as a vulnerability, especially with the precautionary measures that have to be taken to avoid the introduction of the disease, because national veterinary health services have to have better oversight of the characteristics of the exterior border areas that have to be covered by veterinary systems to look at distribution and potential distribution of the pathogen, so that the swine industry from the slaughter houses from throughout the production chain can be aware of all the issues and then identify the conditions, because that could be a gap. It could spread to any country if these measures aren't taken. If there are vulnerabilities from the start, especially with information that is not exact, the country has to work on getting that information to be able to fill in that gap and not break or rupture that chain. And that could be a problem. That could be a gap.
Yes, I agree. I think this tool, it's very useful. What you told us at the very beginning, it is extremely useful. It gives us the opportunity of seeing different points of views and see what is the importance of all this data. And if you don't have the data available, it is important for you to risk it, to look for it and find the answers. Because apart from giving a qualitative information, it also gives us an overall status of the health care of the country. So I have another question. Which person within the veterinary services should complete this tool? Is this a team? Can you give us an idea how a country should be prepared to use this tool? In primer lugar, in first place, I'm sorry, you have to look at the different veterinary services that are available for a country. But for example, when we did it here in Cuba, there were different actors that participated. For example, the ones that were responsible of the surveillance department, the specialists, the swine specialists. For example, here in Cuba, there is personnel that is specifically focused on each animal and the byproducts. So it's also important to invite people that are in charge of the veterinary border protection. That's how we call it in my country. And also the different productive sectors specialists. So from the veterinary point of view, it is important that the department that has to do with border control, it's important for them to participate. And those, the epidemiological surveillance, they should also be there. And these are important aspects in these analyses, and therefore they need to have as much information as possible. For example, in our case, the veterinary division is the one that has all the information of different products, of the transportation, or if there have been any issues in the borders. So it is a joint effort. All the people that are in charge of the swine production, these are key stakeholders within the veterinary division. Okay, thank you very much. And now here we have another question. They're asking if there is like a leaflet and that explains how to fill out these different sheets. Well, yes, we did something that it is not like a leaflet, but it is close to it. And it's developed with 3 different languages. It's a Word document that kind of like explains everything that we have showed today. I think that we can share this. We can share this with you, Erica. Therefore, if anybody is interested in this tool, then they can also receive this complement, which will explain how the tool works. Thank you very much, doctors. We appreciate that. These are the questions so far. And as I mentioned it before, I think that the participants need more exposure, more to the tool, to study it more in detail so they can have more questions after they have used it. So I think that we will just be aware of the future questions that they might send us, and then we will forward it to you. Or they will ask them directly as well. But in any case, I would like to thank you because this is the kind of tool that we need. These are tools that are practical, that are user-friendly, and that the countries can use, especially now, so that we can prevent any outbreak. We hope that it doesn't happen in terms of the African swine fever, but yes, Well, I think that I want to remind all the participants that on November 13th, we have the next webinar, and we will have a little bit more information about risk analysis. We would see which are all the ways of introduction of the African swine fever in the farms once the country is present in the country. Once the disease, it's present in the country. Also, we will see other practical tools to put into practice in terms of the different farms. So Dr. Maria and Dr. Jordi, thank you so much. We will keep asking for information from you. This is just a tiny little seed that will, I'm pretty sure that generate a lot of questions in different countries, and it's important to put this as an official tool available for everyone. Thank you for your participation, and thank you for the participation of everybody, all the different countries that were present. Thank you for all the organizations, all the agencies that we have been working with. Thank you for all these webinars that will finish this year on December 7th, but next year we'll have more because we have a long list that we'll have on this subject. And thank you for all the technical team that it's behind scenes, and they facilitate, they help these webinars to happen. They make them happen. So with no further ado, we're just saying goodbye for now. Thank you very much. A pleasure to meet you, and we will continue to be in touch, and hopefully we'll see each other on November 30th, and I hope you all have a great day. Thank you very much for the opportunity of share this collective work, collective tool. Thank you so much. Thank you very much. They're asking, there's a question here for Jordi, if they can unblock their computer.